We're going to talk about the COVID-19 vaccine. Last week, we had the opportunity to have our first interview with Dr. Laura Morris from MU Healthcare, and she's back with us again to give an update. And I liked what she said during the interview last week, that we need to do this frequently because people have a lot of questions about it, and things change and information becomes available that we didn't have a week ago. So Dr. Morris joins us again. Good morning. How are you?
I'm doing great. Thanks for having me back.
So yesterday I saw the release that came from MU Healthcare, and it was talking about an online survey that people can fill out, and also announcing that when the vaccine becomes available, that you will have a mass vaccination site. Let's start with the website or the survey that people can fill out. Who should be filling that out?
Now we want to emphasize this is the time to go fill out that survey and get your name on the list. For community members, this is going to be kind of the fast track to information about when it will be your turn and how you can sign up for an actual vaccine appointment. So I would encourage everyone who's interested in the vaccine, which I hope is everyone in our community, to go ahead and go fill out that form now.
If I have already filled out the survey that was listed on the City of Columbia website through the health department, do I need to do the one through MU Healthcare also?
I would recommend going ahead to do that one as well, because we are working together with the county health department, but certainly for patients of MU Healthcare, probably the quickest way you're going to get information about when we specifically have our vaccine supply available for the community is to fill out our survey.
And I guess that what will happen is the information that is provided, if it's anything like it was through the city website, when I filled that out, I think I did that on Friday, it asked my age, it asked my occupation, it asked if I had any underlying health care or chronic conditions, and then asked my contact information. And basically, that's it.
Exactly. Those are the key pieces of information to make sure we can get back in touch with you whenever it's your turn. And we're working through those phases. We're in phase 1B, and the first two tiers of that are pretty specific for first responders, so things based on occupation or exposure, and high-risk individuals based on age and medical condition.
But anybody of any age should be signing up on these surveys saying that I want the vaccine. Let me know when I'm eligible and when it's available. That's the bottom line of these surveys.
Absolutely, because, right now those tiers are pretty limited, but in the future, the vaccine's going to be needed for everyone. So it's important to get your name on the list and keep up to date with information as it comes out.
What are you hearing as far as the rollout of the vaccine? And what are you hearing about maybe there'd be more of it at a certain stage, or is it going to be a slower trickle than it would be would it be like a drip in a faucet rather than a fire hose?
We're all hoping that this turns into a fire hose, and I think right now it's somewhere above a trickle, so I think that's a great analogy. Certainly, as the state of Missouri receives more vaccine doses from the federal government, MU Healthcare is prepared to distribute more doses as those become available to us.
What is the plan? Because also in the release yesterday that was talking about the survey that people could fill out saying, hey, I'm eager to take this. Let me know when it's available. Also in that release, it talked about how there will be an area where a central vaccination site. Describe what that would be like.
Absolutely. So we are partnering with the Mizzou Athletic Department and using part of the football stadium, the Walsworth Columns Club, that's at Furrow Field on the east side of the football stadium, and right now it is being transformed into a mass vaccination site. And there's a lot of reasons why those are more efficient than distributing vaccine kind of in the traditional way that people expect through your doctor's office or clinic.
What else are you hearing in regard to different vaccines or the efficiency so far? What would you bring to us on the information level about the vaccines, if anything has happened in the last week?
We continue to be impressed by the safety of the vaccines, and although the reactions and that the side effects profile continues to get a lot of press, in reality, most people's reactions are mild to moderate and transient, and that certainly shouldn't be a reason to discourage anyone from going forward with the vaccine.
And you told me off the air, and this was, I think, another point that you like to make, is that of those who receive the first dose, and those would be healthcare workers or people who are in the tier, I guess, 1A, I guess is what it was, that those who receive the first dose, 98% as of this time have received their second dose?
Yes, and we are really proud of that fact. We've been really efficient and given out over 5,500 healthcare workers vaccine dose number 1 and nearly all of those vaccine number 2. So we are finishing up that 1A tier with some planned clinics here in later January. And then that will allow us to move into phase 1B, tier 1 and tier 2, and make sure that as we get more vaccine supply, we can dedicate it to those next phases.
All right. You told us last week this is a marathon. It's not a sprint, so we're still maybe in the early stages of the marathon, right?
Absolutely. Yep. I think last week we said that the endorphins were starting to pump, and I think it's really important in that marathon that we keep the momentum going and not lose sight of our goal, which is, community immunity, and not just healthcare worker or first responder immunity. So it's important that everyone pay attention and be ready when your turn is called.
Sounds good. Doctor, we look forward to our next visit and next update. Things could happen quickly, or we could be in the early stages of pacing ourselves. But whichever way it is, we'll look forward to talking to you again to get the update on the vaccines. Thank you so much for your time.
You're welcome. Have a great day.
You too. Dr. Laura Morris from MU Healthcare talking about the update of vaccine. Again, sign up for the survey. Go to muhealth.org/form/COVID vaccine survey, or just go to muhealth.org. I think from there you'll find a pretty easy link to find that survey. Whether you've signed up through the city survey or not, Dr. Morris suggests that you sign up on this one also, because that is the quickest way to make sure that your name is on every list available, so that when the vaccine is available, you'll be notified and you can get it. This is Columbia Morning at KFRU.